Great. Thank you so much, Tony. That was excellent. Just it's a great segue, going from the causes to what great work you're doing to now Dr. Rick Coughlin, who's a dear friend and the founder of IGOT, which is the Institute for Global Orthopedics and Traumatology here at UCSF. So Rick's going to talk about partnership models between high and low and middle income countries. So go ahead, Rick.
Do you see my screen?
Yep.
Great. Well, thank you so much, Sanjeev, for allowing me to sort of step back again and just kind of look at, I'm not a pediatrician, I'm not a pediatric orthopedic surgeon, traumatologist, but I have been involved in global work for 3 or 4 decades now. So my talk today will be fairly generic, talking about partnership models, and I have no disclosures, although I was founder, director emeritus of the Institute for Global Orthopedics and Traumatology. Really happy
Rick,
to...
do you want to just use your screen, the full screen of the slide?
I'm sorry, Sanjeev?
We're just seeing something on the side, but I guess it's okay. Do you know how to do the full screen?
Screen sharing.
Now, screen share is good.
Pardon?
No, screen share is fine. We're just seeing something on the side, but I guess it's okay. I'm sorry. You can go ahead.
If I do that,
better.
That's better.
Yeah,
I'm going to make things big, which is easier for my eyes. So again, no financial disclosures. And it was really great to listen to Dr. Cooper's work, because it dovetails directly into what I'll be speaking about, which is how do we partner? So let's step back. We know globally there's an enormous burden of disease, and it's clearly growing. We know that there's an enormous disparity of healthcare workers globally, especially in low and middle income countries. There clearly is no equivalency of resources around the world. This disparity also includes enormous lack of funding and the money for low and middle income countries. So where is the money, and who's responsible for educating around the world? And do we have ways to measure that success of these partnerships or programs? And how can tech maybe bridge this enormous disparity? Well, here are the answers. Yes, there's lots of disparity, but where's the money? And no one really knows where the money is. No one's really particularly responsible. It's awfully hard to measure success of educational programs, but seeing in the last 3 years with COVID and our ability to leverage digital platforms, there are some tech solutions that hopefully will solve some of these educational dilemmas. So the fundamental problem really is the lack of healthcare providers that we have globally, and this is the main issue that we need to address. And the continent of Africa is estimated to be needing at least 1 million healthcare workers to deal with their enormous burden. Looking at this scale globally with a map, it doesn't take much effort to see that the problem's right in the middle. It's the continent of Africa that has this dearth of healthcare providers. If we look at overall disability issues around the world, well, most of the world really just deals with low back pain. It's, again, the continent of Africa that gives us a variety of issues that we need to be dealing with and improving their livelihoods. This group isn't surprised that the leading cause of death is road traffic injuries and for adolescents. So the burden really is borne by the young. looking at another scale of trauma and the impact globally is injury far outsizes the leading causes of mortality comparing to HIV, AIDS, TB, and malaria. Historically, we have gotten involved in, quote, global orthopedics from the developed countries of the UK and the United States. And the World Orthopedic Concern is a historical NGO which got involved in both surgical and non-surgical care, and really well known for its heroic battle against polio. In the United States, Orthopedics Overseas was founded using a framework much more relevant of teaching and training. And it continues on as a subgroup of health volunteers overseas. So there are lots of different types of models that we could talk about and discuss the upsides and downsides, but generally speaking, they can be divided into this group. There are plenty of short-term entities of NGOs that go out into the world. Largely, they're mission-based or service-based. And an example of that is Operation Rainbow, which is a pediatric surgery group that provides care in Central America. Orthopedics Overseas, again, is a little bit longer term, where they have people in positions for 4 to 6 weeks, sometimes longer, but again, focusing more on teaching and training. There's a model of the provision of material or implants, and the SIGN Group out of Washington is well known for its development of the SIGN nail and the impact and enormous impact that NGO has had and broken femurs and tibias throughout the world. NGO model of educational materials. A fine example in the pediatric world was by a initiative by Lynn Staley out of Seattle called Global Help, which provided the accessible, available pediatric knowledge that would be online. Another example, which is our group and University of British Columbia, clearly is a prime example of this twinning type of model of partnership, and it focuses a lot more on the academic to academic partnership and all of the upsides that can come about through teaching, training, research, and the like. Most people know of MSF for disaster relief, and they clearly lead the league with their involvement in disasters. Another model which has been successful over the years has been that of CURE International Hospitals, and I think there are about 8 or 9, largely in Africa. And this model is more based on hospital management and provision of surgical care in those countries. I'd be remiss to not talk about maybe a southern solution, not a north to south, but a southern solution in India, and it's the for-profit model. And that, the Narayana Health System, I think it's about 20 years old, really focused on leveraging the for-profit and high-tech and high-volume approach to provide more readily accessible and affordable care for those patients in great need in India. Again, there's a plethora of NGOs that are involved in this work of helping overseas and and they largely lie within both the sectarian and non-sectarian worlds. But again, this is have been more focused on provision of care rather than teaching and training. So where are we now overall? And I think historically, again, orthopedic surgery has been a prime example, along with plastic surgery, in their approach to global health was more based on volunteerism and service, and with short-term missions and again, all the potential upsides and downsides of that type of model. But now increasingly over the last 10, 15 years, there's been this greater recognition that we need to be more involved in with our global health partners, and a new orthopedic surgery should be based more on sustainable partnerships, research, education, and capacity building, much like you heard from Dr. Cooper. So where is orthopedics at UCSF, the University of California, San Francisco? And again, we sort of started in the late 1980s going through these models on our own. And initially we partnered with a service organization called Operation Rainbow. And that is, again, a pediatric organization, NGO, providing care to kids largely in Central America. And the involvement of our residents and medical students clearly was very important as we continue to learn more about the enormous burden that exists throughout the world. We continued on with our interest, and fortunately it's a culture of involvement here in San Francisco, much like British Columbia. But we started with the next organization called Orthopedics Overseas, again, using that teaching training model. And here's a picture of one of my heroes, Chris McConaughey, who I met in 1998, who ran the Orthopedics Overseas site in Umtata, South Africa. And clearly it became what we felt a great model for our resident elective that we started in 1999, really giving our residents an opportunity to experience what the need is. And this was an extremely successful program for us. And we expanded that to other sites and other academic sites, so that initially we were going to South Africa, but quickly found other very strong academic sites in Dar es Salaam, Tanzania, and in Ghana. And most of our residents are between those two sites in Malawi at this time. So our next evolution of thought really came in 2006, where both the faculty and residents got together to kind of create a better model. And this was really what we felt was a model that would exist for collaboration and hopefully great change. And that's the Institute for Global Orthopedics and Traumatology. Our understanding was that really it's the partnerships that are potentially going to have the greatest impact as we look at the future of global orthopedics. And this is an article that we wrote in 2013 based on the work with IGOT. So it's the collaboration, it's the synergy that is ultimately going to start to take the bite out of the elephant. But where's the money? Well, we know that there's enormous disparity for low middle income countries, that the research is 90-10, that even in these countries, most of the GDP are military spending, and only 3% spent on healthcare in these countries, whereas we're now up to 20% in the United States. So there are some bigger donors, the World Bank, and organizations, the Gates and Clinton Foundation, that have started to come around for monetary solutions. But the governments really aren't the answer. Most of the systems are poor and corrupt. Although the community resources are inadequate, they're extremely important to understand the need and the context. Ultimately, there probably needs to be some type of incentivization that will help us to move this needle forward. And perhaps the public-private partnerships will be the way as we move forward. Increasingly, our societies have gotten involved. The OTA has a humanitarian committee, the Foot and Ankle Society, the Vietnam Outreach, Pediatrics also leads the league in their efforts to be involved in this global orthopedic care. But many of the other organizations, international, have stepped up increasingly. CCOT and even our academy has done that. And there's some other global professional societies such as AO Foundation and AO Alliance that have come to the table. So there's lots of stakeholders that need to be involved, but ultimately the success is going to be through synergistic collaborators and collaboration in these partnerships. There's a great need to bring the stakeholders together and all those money resources we can to the table. But as we all know, the more players there are, the more politics and the greater the complexity of governance. Clearly, we're seeing that the new technologies are really maybe the best for bringing us closer and have this opportunity. This webinar in itself is a great example, but the digital platforms of YouTube, ViewMedi, the online courses, all of these things are coming to the table now in rapid fashion, but clearly have the ability to have this knowledge base shared globally. So ultimately, the success is possible, sustainability is possible, but it really does require an enormous political will from leadership. There's not a lot of money in this. It's going to require broad partnership from the stakeholders, probably some public-private partnerships, international funding, and again, leveraging these new online technologies. AI and virtual reality also can come to the table. So my favorite quote, and I'll leave you with this: education is the most powerful weapon, and it can you can use to change the world. Nelson Mandela. So thank you, Sanjeev, for allowing me to run through this talk.